Your nails look pretty.
Aren't those cute? But you know what I don't like is like, hi, welcome to Well Rounded Momma's YouTube channel. My name's Sherry, this is Sarah, and this is Tiffany. We are all midwives at Well Rounded Momma, located in Las Vegas, Nevada, if you're just joining us. If you find this video helpful, please like, subscribe, share with your friends, ring the bell so that you can get all of our new videos dinging on your phone, because everyone likes phone notifications. That was sarcasm. Today we're going to be talking about, do doctors work with midwives? I kind of played with the title a little bit because I was kind of like, do doctors like midwives? Do doctors talk to midwives? Do doctors and midwives work together? Like, what does that look like? The best of both worlds would be some kind of a collaborative between nurse midwife, CPM, certified professional midwife, and physician. That would be like in an ideal world. And then there are some states that exist in. So we really can just speak on our own state. We are considered illegal in the state of Nevada, which means that we do not currently have licensure specifically for direct entry midwives, which is what we are. Because there is no licensure, we are licensed as drugless practitioners and are able to successfully practice midwifery, but it does kind of tie our hands in some areas. Is why would a midwife need or want to collaborate with a physician, and where do we get a lot of help and where do we get pushback and resistance? And I think that this video would be helpful, and we get a lot of clients coming in asking us, what do our transports look like? What do your relationships with physicians look like? Those are really good questions to ask any care provider. I thought I would start talking a little bit about why would we want physician collaboration at all during prenatal care?
In some cases, it's nice if there's some sort of established collaboration for things like if a mom does get a UTI, then they can prescribe medication. We don't prescribe medications. So in that case, it's nice to have a physician to collaborate with. If we are seeing something that's concerning on our end, then we have somebody that we can follow through with physician-wise, just to make sure that you stay low risk. Seamless transfer of care.
And we've always been super lucky at Well Rounded Momma. We have a lot of physicians that we talk to and work with. That's probably because I'm pretty obnoxious and assume that everybody would like to talk and work with me. So we're lucky in that sense. So sometimes if something comes back maybe in lab work that we haven't seen before, we can, talk to a physician and say, hey, what are your thoughts about this? Or, hey, would you be willing to see this client for an appointment and check the position of the baby? Or, and so we've always been really lucky in that respect, I think, here at Well Rounded Momma, and that we've always had a doctor on our phone that is willing to take our calls and respond to our texts. We just hired an advanced practice nurse, and so she is able to do those things. And so we're really excited to kind of launch her services in January. She will have already started by the time you are watching this video. Now we do also, and I want to mention, we do work with a group of perinatologists. We have 2 groups in town, and they're really great to work with our clients. The great thing about working with perinatologists is they are only seeing high-risk individuals, and so a lot of things that we start stressing about, they're like, oh, that's totally fine.
It's not a big deal.
That's not a big deal. It's really great for our clients when they have something like maybe a thyroid issue that they want to be seen as dual care, because, keeping an eye on a woman's thyroid, if they're already on medication, it's nice to have a physician, whether that be their endocrinologist or a DPA. So the next big question would be, how would our relationship with a physician during some kind of a transport or complication during labor and delivery, why would that be a benefit, and what does that look like for people?
If we have that collaboration with somebody that we can call, then there's that continuity of care for them with somebody they already know. And if it's somebody they've already seen, they already have a chart on them, they already kind of know their history. And it just makes things go a lot smoother when you go to the hospital to have that, because then they know you're under the care of a physician. Because sometimes at the hospital, if they know you're under the care with a midwife, it's not always received the same. So it's nice to be able to have somebody that you can call and be like, okay, I have this going on. Can you help me out? Or who is on call? Anyway, when you have that physician that you're able to call, your clients are going to be able to be taken care of. A laborist is a hospital OBGYN that's there 24/7 every day. So 365 days a year, there's somebody on call that is an OBGYN at the hospital. So if you have to go to the hospital, there's always a doctor there. What's nice is if you do have collaboration with a physician, you don't always have to rely on the laborist, because sometimes that's kind of hit and miss.
Why would a physician not want to collaborate with a midwife? Because we are illegal in this state, a lot of the physicians here feel like they're assuming some level of liability and responsibility. Right. Most OBs here, if they find out that you're having a home birth or you're seeing a midwife, they'll discharge you from care. And so I think it's why it's really important that as midwives, we establish relationships with physicians and nurse midwives in the Valley. As midwives, I feel like that's our job to build those relationships. I think probably the biggest misunderstanding in the field of medicine about midwifery care is that we are doing what they do in a hospital and at home. So there's this misunderstanding that we are doing very scary things outside of a hospital setting. So any birth, like they don't refer to it as home birth, it's called out of hospital birth. And so any out of hospital setting, there's always a concern that there's not an OR of the room or they're not prepared for that. And we are very lucky in this town, and we have like hospitals on every corner.
Yes.
And so our response time for our EMS services and our EMT services are really fast. And how, as midwives, do we kind of combat this misinformation and miseducation?
Not being afraid to talk to physicians and try to establish that collaborative care. Like, our protocols are different because we are trying to prevent complications. We know there's not an OR down the hallway, so we're not pushing the envelope.
Some things that we do at some of the hospitals are called in-services. And so a lot of the hospitals here will allow us to go in and kind of talk to them about what is the best way to transport our clients? What kind of information do you need?
What is in our scope of practice?
Yeah.
I just had a nurse a few weeks ago that was wonderful because she said, I believe that every mom should have the choices that they want to make and be supported in those options. And I just thought, wow, that was like a breath of fresh air to walk in here and be told that and not treated like I'm a crazy person.
And I guess I want to end with the story that kept coming to me when I thought about like collaborative care with a physician. It was a birth that actually Sarah and I attended. And as practitioners, sometimes we still see that racism is alive and well in our country. Sarah and I were at a birth, and it was a young high school girl, and she did have high blood pressure, and she was a person of color, and we were monitoring her so closely, and all of her family members were there. Her grandmother, her aunt was there.
Several generations.
Oh my gosh, several generations. And the stories they were telling about how they've been mistreated and loss of life that was so preventable. This client, when she entered into active labor, had a seizure, and so we called 911, and her mom, we followed behind them in the ambulance, and she said, what if they turn us away? And I was like, hospitals don't turn people away. And the next phone call I got was from the mom saying the physician, she said, I'm watching my daughter seize right now, and the physician says that they're turning us away. And that was such a shock to me because it had been the first time that had happened in my career. And the fact that I could pick up my phone, make a phone call, and that individual got care right away because of the relationship I had with another physician. And it just was a really big eye-opening to me that on a global level where we can improve care, I think that's a big part that we need to be not afraid to have those conversations. And it really, I think, was the time where I thought, oh my gosh, this is worth every butt chewing I've gotten from a physician. That what I went through was so minimal compared to what individuals of color have gone through when it comes to the level of care that they have received. I think that's a hard conversation to have, but I think in a really important one, and one I really wanted to end on because it really is something here at Well Rounded Momma that we feel so passionate about improving and doing better every single day. And the language we use, the language that we help other individuals use, and that everybody deserves that equal best of care so that we can improve outcomes for mothers and babies. We are so grateful for the physicians and care providers that do have those hard conversations with us, because there are amazing physicians and doctors out there. Collaborating and having discussions with physicians is important to us here at Well Rounded Momma. And I know every state has their own hurdles to go through for making sure that our clients are getting the best of care, because that's what we want. Thanks for joining us, and Hopefully you will like, subscribe, share with your friends. And if you feel passionate about midwifery care and that right to choose, find out what's happening at a state level in your state. If you feel passionate about it, share this video and start writing to your legislators that it's important to you. Physicians need us as much as we need them.
Well, and according to the World Health
Outcomes.
Organization, midwifery is the key.
Yeah.
Like they've announced that midwifery is the key, that our model of care specifically can reduce global C-section rates and
Absolutely.
global poor outcomes.
It's just a really beautiful model when you look at physicians taking care of your high-risk clients, midwives taking care of your low-risk clients, and collaborating to make sure that
They stay that
the
way.
ones that are high risk are getting the full attention of the physicians, and the ones that are low risk are getting the full attention of the midwives.
Yeah.
And that's really what those long-term goals are. So